And welcome back. Recently, the House of Representatives passed the GOP Health Care bill to replace Obamacare. As the bill awaits decision from the Senate, many people are concerned with what might possibly be the outcome. Now, joining us to discuss the effects of the GOP Health Care bill, we welcome now the Senior Vice President of Government Affairs and Healthcare Policy from Affinity Health Plan. We welcome now Abby Udochi. Thank you so much for coming and sharing with us.
Thanks, Daren.
Good to have you.
Glad to be here.
So a lot of talk is still about the American Health Care
yeah.
Act, and a lot of people have a lot of concerns.
Yes.
And so when we talk about this, first of all, with the new bill, what happens? How does this work out?
So I can't predict the future,
Right.
but I can give you information as I know it. The bill is dense. There are a lot of moving parts, a number of provisions that are going to impact a lot of Bronxites, New Yorkers, and people around the country. As a matter of fact, I estimate that there are about 50% of Bronx residents who will be impacted by the provisions in this bill if it
50%.
should be 50% if it should become law. That is about 700,000, a little less than that, of the 1.38 million people who live in the Bronx. And these are people who get their health coverage through Medicaid managed care, through New York's Essential Plan, and through the Qualified Health Plan, all of which can be enrolled. They can enroll on using the New York State of Health Marketplace. So, like you say, this is a complicated issue, and a lot of folks are concerned. I think what's important for people to remember right off the bat is that this is not yet law of the land. The the ACA is the law of the land today, or Obamacare. ACA, Obamacare, Medicaid expansion, they are all wrapped up in the same, with the same ribbon, right? So folks don't have to be concerned yesterday, today, or even literally tomorrow about what's going to happen with their coverage, but this is a bill that they definitely should be following.
If it passes the Senate, then of course it becomes law. Then we have to deal with the ramifications thereof. And
Exactly
so for people who are questioning right now, a lot of questions about paying and how much am I going to pay if this new bill becomes enacted. So if the new bill goes forward, how much more are people paying?
Yeah, so that really is going to depend on the state that you live in. And whether or not the state that you live in is interested in implementing any number of waivers that they could use to request changes to the products that they offer on their marketplaces in their state. So we live in a very liberal state. We live in a state where the governor and the Medicaid director and those who are responsible for the government-sponsored health insurance products and even the commercial products are really interested, I can say sincerely, in making sure that everyone has access to health coverage who needs it and should have it. That's from adults to children to senior citizens. So the three products that I think Bronxites should really pay attention to are Medicaid, the Essential Plan, and the Qualified Health Plan. So what could happen with Medicaid? I doubt very highly that people who are eligible for Medicaid will in the future have to pay into Medicaid, like some states like Indiana require that Medicaid recipients who are in managed care pay $1 a month. I'm not hearing any conversation moving in that direction in New York if this bill should become law. The Essential Plan, though, is a product for which people do have to pay a small premium. If you qualify based on your income, there are a segment of folks who are in that product who pay $20 a month. The Essential Plan is a wonderful program in that New York State is one of only 2 states in the nation that have opted into this product. It's for people who are classified as the working poor. They are adults. They are working typically low-wage jobs, and they have the opportunity to get very rich coverage through the Essential Plan. Now, the way the Essential Plan works is through tax subsidies. So you can receive a tax subsidy and pay for this coverage, so it's highly subsidized that way, plus you pay into the $20 a month, and some are free, depending on their income. So because the American Health Care Act changes the way the tax structure would work to fund this product, that's one of the things that people are really going to need to watch as the bill rolls through the Senate.
Walk me through a little bit with the pre-existing conditions, because that's on the hearts and minds of a lot of people.
It is.
The fact of whether or not I have pre-existing conditions and where that plays out in this particular bill. Right.
So from what I understand, pre-existing conditions are definitely in the bill, the American Health Care Act. So people don't have to worry about if they have a pre-existing condition not being eligible for coverage. So a pre-existing condition will not keep you from getting coverage if this bill should become law. However, there is the matter of continuous coverage or continuous enrollment. So whether you have a pre-existing condition or not, if this bill should become law in its current form, what the AHCA calls for is for folks having no more than 63 days of disenrollment or unenrollment over the course of 12 months, continuous days. So if you should lose your coverage for 63 days or longer, depending on the state that you live in, according to this bill, which is not yet law, a state could or an insurer would be allowed to charge you 30% more for your premium for a 12-month period of time. So the bill calls this an incentive to retain your continuous coverage. So whether you have a pre-existing condition or not, you could fall into this loophole if the ACA should pass in its current form.
And we talk about if the bill passes, obviously it has
That's
to
right.
pass through the Senate. I know there's a lot of groundwork that's being done right now
That's right.
of making awareness, particularly with the population of the Bronx in here. What can people do in a season such as this, because we still have one more house to pass, if you will, before this goes forward?
Well, actually, there might be two more. So depending on how much work the Senate does on this bill, it might have to go back to the House.
Right.
Or they could put a joint committee together and decide what they're going to accept from the two different bills. And then they would have to vote again, and then it would go to the president for a signature. But so what that means is there's still time to impact how things turn out. And we know the groundswell of community activity that happened when the House tried to pass this the first time, and even the second time when it actually did pass, right? So it's really important for people to know, I think, a couple of things: to get educated and then to get engaged. To get educated, they can certainly go to, there are lots of resources on the internet. One of them that I like the most is the Kaiser Family Foundation, and that can be found at kff.org. They've got lots of information, detailed information about the provisions of the bill, and so any questions that you have can really be answered at that site. The other thing that folks can do is go to the New York State Board of Elections website, and right on the home page is a button for finding your elected official. And this is really critical. Whether you're a Republican or a Democrat or an independent, bipartisan, it doesn't matter. You should know who your elected official is, either as a member of Congress, state Senate, state assembly. Get in touch with your member of Congress and voice your opinion. If that member of Congress is having a town hall meeting in your neighborhood anytime soon, get engaged, go. Ask questions, make them explain themselves, make them talk about what this bill is going to do to impact their lives, and tell them whether or not you're in favor or you're against, so that they at least know what the people who they were elected to represent want them to do.
With your expertise, boots on the ground, seeing and hearing what people are saying, what's the mood? What are you getting from people on the street?
So that's a good question. So I work for a health plan, obviously, and we have members who call us or meet us at our community service centers. We have 18 of them around our 10-county service area in New York State, and people are concerned, rightly so. They want to know that their health coverage is going to remain intact no matter who's in the White House in Washington. They really want to just know that they will continue to have a relationship with their doctor. They will be able to take their children to get their immunizations. If they have a parent who's a senior, that parent will have access to their coverage, and they can move from one area of wellness to another in their lives. So it really is just important that folks not worry so much, but instead get active and get engaged in the conversation and get educated about what people are wanting to do to the health care that they have a right to.
And I think it's important to let people know that the Affordable Care Act is still in place.
That's exactly right. So please make a phone call, write a letter, get to a town hall meeting, voice your opinion. This is not yet law of the land. Law of the land is still the Affordable Care Act.
Abenaa Udochi, Senior Vice President of Government Affairs and Healthcare Policy at Affinity Health Care Plan. Thank you so much.
You're welcome. It's
All
a pleasure.
righty. Listen, taking a quick break. Be back with more show. We're coming right back right after this.